knowing that I was coming to the end of my CAMS journey, it was quite daunting at first because I didn't think there'd be any other help there.
Thurrock CAMS services were experiencing a high demand and long waiting times for their services, and we were keen as commissioners to look at ways to help them face that challenge. One of the things we found was that clinicians felt that they were holding on to young people into the service and not discharging them.
My worry as a clinician was, where are young people going to go? You know, they're working with us, you build a relationship, you build a rapport, you put your heart and soul into the job, to be fair. And knowing, however, that there's more need out there, there's more young people that need our services. So you're kind of balancing all of the time, you know, when do you discharge, when's the right time to discharge?
So we wanted to find a way of really supporting young people as they transition from the service and move out into the community. It was very important that we developed a person-centred approach and wanted to offer personal health budgets as part of that offer. We developed a business case that was presented to the Collaborative Commissioning Forum in Essex, which was supported and implemented last year.
Kieran, hello.
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 Hi. So has Paula told you about me?
Yeah.
I'm the youth facilitator for Positive Pathways. Nice to meet you.
At Thurrock and Brentwood Mind, we've employed a youth facilitator to work within the CAMS team locally. And her role is really to meet with young people, their parents, carers and the therapists, and to look at what their interests are and what they hope to achieve. So it's really a social prescribing model.
Hi, my name's Kiran. I'm the youth facilitator for Positive Pathways and I work for Thurrock Mind to help young people transition back into the community through offering them extra support.
There are 4 stages to the process. The first stage is a CAMS worker and a Mind Youth facilitator have a pre-discharge meeting with the young person and family.
So why don't you tell me about a few things, some interests that you might have that I could maybe, just to get to know you so I can see where I can help you.
The second stage is a personalised care and support plan session with a Mind worker takes place with the young person and family.
When we first met Kieran, it was after one of Lily's counselling sessions. She got introduced to us to help Lily do things like on the other side of counselling, and she's given me lots and lots of information for the help that's also out there for me.
What kind of things have helped you so far then? Because we've done quite a few things together, haven't we?
Like counselling, like just talking to all different people. Like just
the music school as well.
Yeah.
Like Shadow Taste.
It's just helped me boost my confidence. Like that's the main thing.
Third stage, the Mind You facilitator sees what's available in the community to meet the needs of the care plan and to support the young person.
As part of young people's personalised care plan, I introduced them to other organisations in Thurrock, such as Thurrock Mind, Prince's Trust, Inspire Youth, Open Door, Peer Mentoring and Temple Springs, the music school. And I walk them down to the organisation to introduce them to the services.
Stage 4 is the personal health budget, where it is used for young person's needs where there isn't an available community service already identified.
And now you've got your own little circle of friends and, like-minded. Joe shared his interest in music and how he wasn't able to access that in college. So I applied for a personal health budget and so he managed to get 12 paid sessions for one-to-one tutoring for keyboard lessons.
Oh, it's boosted my confidence immensely. I can now actually be confident in going up the stages.
Joe's never ever picked a career. He didn't know what he wanted to do. But music, I know that he really enjoys and he loves to do it, and hopefully by this he can do that.
Ellie, when I first met with her, she shared about the lack of the social groups that she struggled with. So part of my work was making groups, and it really helped her meet new friends.
She put me places like Temple Springs, where I got offered a job, and it's given me the opportunity to grow more in myself that I wouldn't have had otherwise.
We are really proud of the work that's being carried out here from our CAMS services and Mind, working in partnership with wider stakeholders across Thurrock. It's been really exciting to see their relationship grow and flourish, with new ideas coming out every time we meet.
The best thing about the whole project is just opening up. It's almost like we've had French windows put into the clinic, and suddenly we can see the outside community and we can see all the resources that are available there.
40 young people have been through the system so far, only 6 of which have actually required a personal health budget to support their personalised plan. This really reflects the amount of resource and opportunities there are out there in the community for young people in Thurrock.
I know now that I'm very confident when I discharge somebody, there's something else out there for them. There's another kind of plan of care.
I really enjoy my work, supporting young people, seeing them flourish. It's almost as if I'm walking alongside them on their journey.
Like she's an angel in disguise for us.
Luckily I had Kieran and the Positive Pathways worker there to give me more guidance and support that I needed.